Hey, how are you? Okay. How has your mental health been? Yeah, we are definitely living in some stressful times. Have you been finding any kind of ways to have some peace, center yourself amidst all of it? Okay, that's good. So, it's been a while since I've seen you. Do you have any specific concerns about anything that's been going on? Okay. And is that both shoulders or just one? Okay. How do you think you injured it? Okay. We'll take a look at that in just a few moments. Let's see. Any changes to your medications? Any new supplements or anything? And do you need any refills today on any meds? Yeah, we can do that. Okay, so let's go ahead and get started. We're going to kind of work our way from the top on down, if that's okay with you. And, hold on just a second. Oh, left it on top of the gloves. Okay. And actually, quick question. Have you eaten anything today? Okay. No, that's fine. I am going to order some lab work, and part of that includes a cholesterol panel. And so it's just helpful to know whether or not you're fasting. Just so that way when we read the results, we have a basis of understanding of, oh, they ate breakfast, that's why this number is in this range, versus if you were fasting, it may be interpreted in a different way. So, alright, I'm going to stop. I don't know if I said this already. We're going to work from the top to the bottom, starting with your head, okay? So I'm just looking at you, seeing if there's any kind of changes I can visualize. But you look pretty good to me. So, okay. Is it okay with you if I touch you? Thank you. Take a look at your hairline. A little bit of scalp dryness, but not anything overly concerning. If it's bugging you, you can always use dandruff shampoo. You just want to make sure that you're not using one that's too strong, because that can further dry you out. Some of them are intended for treatment of fungal issues on the scalp. Feeling your cranium, making sure you don't feel any bumps. Okay. You're going to feel me pressing on your temporomandibular joint. Can I have you open your mouth for me? Good. You can close. Open again. Close. And open one more time for me, please. And close. Okay. Any pain with that? Okay, how about any kind of clicking? Now I'm going to push on your eyebrows. Can I have you try and furrow, kind of push against my fingers? Good. Same thing. Smile, push against my fingers. Good. And I'm just going to take a look at your skin. Looks good. I'm gonna get a bit close up to you, okay? Place my hand on your head here, kind of steady. Trying to keep your eyes open. Got my hand on your head. Okay. your head towards me here, okay? And I'd like you to direct your gaze right here between my eyebrows. Pull your eyelid down just a little. Can I have you look up? Okay. And other eye, same thing. Look up for me. Great. And then don't move your head. I just want you to follow my light just using your eyes. And I'm just going to palpate a little bit around the eyes and the infraorbital space. Let me know if anything is tender. Can you close your eyes for me? You can open. You take a peek inside of your ears, okay? I'm gonna feel me kind of pulling your ear back here. Your ear is nice and clean. How's this side? Any tenderness or discomfort? Okay. This side is nice and clean too. I'm not seeing any kind of fluid or buildup of wax. Your eardrum is intact. I'm not seeing any kind of inflammation or redness or drainage. Okay, so your ears look good. Swap this out. And I'm going to take a quick peek inside of your nose, alright? So I apologize if this is a little bit ticklish. Okay, other nostril. Good. Nice and clear. And I'm going to take a quick peek inside of your mouth if you don't mind opening for me. Great. And I'm going to push this against your cheek. And, pardon me, the other side. Okay. Can I have you just lift up your tongue for me? Great. Okay. You can relax. And I'm going to have a quick peek at the external ears. That side looks good. Let's take a look at the other one. Sorry. Both of your ears look good. So now I'm going to be feeling your throat, okay? Looking for any kind of swelling, lymphadenopathy. One more time. Good. Just gonna take a quick listen to your carotid arteries. Other side. Okay. Everything looks and sounds good there. Okay. So now I'm going to listen to your chest. So. Can I have you take a deep breath in for me? Out. Okay. Another nice deep breath. Again. And again. I'm going to reach around to your back here. Another deep breath. Good. And the other side as well. One more deep breath. Okay. And now you can breathe normally. I'm just going to listen to your tummy. Okay. Everything sounds good. So I'm just going to be kind of tapping on your chest a little bit here, and then we'll do something similar with your tummy. kind of different tapping here. Then you're going to feel me just kind of pressing. Let me know if you feel any kind of tenderness or discomfort. Feel around to your kidneys in the back here. Any discomfort? All right, that's all in good shape. Okay, so we're going to look at your extremities and we'll start with the shoulder in question. So I'm going to feel them both so that way I'm able to have some kind of comparison between the two, okay? So I'm going to do my best to be gentle. I'm definitely feeling some hypertonicity on the left. I'm just going to kind of move the arm just to test your range of motion here, okay? Don't let me push the arm down. Good. And don't let me lift it up. Okay, you can relax. So it feels to me like we have a bit of a muscle strain occurring here. So what I recommend is just backing off for maybe a week or two just to let things heal. Yeah, you can still work out your legs. But just give your shoulder a rest here. Because shoulder injuries can snowball quickly if you don't back off of them and become something more significant very easily. They are well, let me put it like this. Our arms and legs work like a pulley system, and the shoulder is the top of the chain. So if there's an issue here, often it means that the entire chain can eventually get out of whack if we don't give it a chance to rest and heal. So rest, ice it, You don't need to worry too much about elevation, but just rest in ice. If you have a compression sleeve that goes all the way up here, that can be helpful. And then when you do get back to it, just start slow. Maybe light weights, and then as that starts to feel more comfortable, increase, but don't go too quickly. And also might be a good idea to look into a mobility program, because especially as we age, we start to lose some of that. And mobility is actually an important aspect of strength. If you can't move a joint through its entire range of motion that it should move, then that also limits your muscle's ability to contract and bear weight to its fullest extent. And that can cause other problems down the road. Arms feel okay. So really it's just this shoulder. And looking at your legs here. Any kind of knee pain, any kind of knee pain or ankle. Okay. Gonna test your reflexes. Okay, good. Alright, so now what we're going to do are some different sensation tests. Something we like to do as our patients get older. So we're going to start with sharp using the pinwheel. So let me know when you feel it. Good. Good. Alright, so now we're going to replace that with a different instrument, and this is, still kind of sharp, but in a little bit of a different way. So, good. Okay. Good. Good. Excellent. And now we're going to do soft. Good. 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 Okay. Good. Good. All right. Let's take off my gloves now. Okay. So now we like to do some cognitive testing with our adult patients here, okay? And so you will see that I have this sheet here of different colored dots. So to start, can you tell me what color dots you see? Yeah. Do you see any green? How about orange? Any purple? Okay. What color is this? Good. And this? How about this one? And here? Okay. So, is this yellow? How about this one? Is this yellow? Good. Is this red? How about here? Okay. I think that is 20. So, okay. Let's write in your refills, and I will have one of my assistants call them in for you. Generic is fine. how it's already December. That went so quickly. It's wild, but I think I say that every single year. So, okay. If you were able to, I think it would be great if you could get your lab work done today. At this time of day, the lab should not be too backed up, so it shouldn't take you too long to do it, okay? Okay. I'm going to pass off your chart here to one of my assistants to have them call in your prescription, and I'll have them give you a call once they're called in, so that way you have some kind of ballpark of when to expect the prescriptions to be ready. That being said, before I step out, do you have any questions or concerns for me? Okay. So then, remember, like I said, make sure you let that shoulder rest. Ice it, compression if it's comfortable, but just give it some time. Alright? Okay. It was really nice to see you, and I'll give you a call as soon as we have your lab results back, okay? Okay. You take care.